I am Julie Novak. I serve as the Vice President of Youth Protection for Big Brothers Big Sisters of America. I'm delighted to be here with you all today. I'm joined by a panel I'll introduce in a few minutes, but we wanted to just start out with some opening remarks. Our session this morning is focused on addressing the crisis of youth mental health on the ground. We're going to talk about the call to action that was brought about by the Surgeon General's report, his advisory in December of 2021. We're also going to hear from our panel about their experiences on the ground. And we also want to make sure that we look to all of you for your questions, for your thoughts when we move to the Q&A section toward the end of the session. So just a little bit about myself. As I said, I work with Big Brothers Big Sisters of America. Our organization is 100 and something years old, 120 something, I think. The primary purpose of our organization is that we place caring adults in the lives of children and youth across the country. We've placed millions of caring, trusted adults in the lives of children. The children that we serve, 70% are children of color. We have programs that work with children whose parents have been or are incarcerated. We have programs that are school-based, community-based, Boys and Girls Club-based, and community-based as well. And our organization has taken on this call to action that was raised by the Surgeon General recently, and has formed partnerships with the individuals you see on the stage today, which I'm really, really proud of. One other thing I want to do before we start, I also want to make sure that I thank Centurion, a great supporter of Big Brothers Big Sisters of America and the work that we do locally on the ground, and the sponsor of this panel this morning. So thank you so much for bringing us here. We're delighted to be here. So we want to open up on a subject that can be a little bit dark. We want to open up with something that is on the lighter side. I want to play a video, and I did not grab the flipper. I'm going to do that. A video for you, quick, and I hope you enjoy it. I think you will.
And it was interesting to see what the priorities of a 7-year-old are compared to mine. I took Samir to the Natural History Museum, and all Samir wanted to do was to get a Subway sub because he saw Subway on the way in. Made me realize that I should change my expectations for, what we were gonna do from then on.
As the time went on, we just grew closer, never faded, and now he's like a role model to me. It's crazy. Now I don't hesitate to text him or call him like, hey, you wanna come to my game? You wanna do something? I've gotten a lot stronger since I've been with him. Before I started lifting, I was little, but now I'm an absolute beast. You get to talk to him about stuff like that you would never talk to anybody else about, like about your personal life. And it's like, he's somebody you could talk to, mentor you through everything.
As the mentor, you always kind of have anxiety, like, oh my gosh, I haven't seen him in this many months, or we haven't done anything, and I haven't done a great job. And then you hang out and you realize, like, for the past 8 years, we've been buds and, friends and brothers. So, like, it's nice to realize, like, all that quality time and relationship building is, like, still there, even if you might feel sometimes that you're not doing the best job as a mentor.
Tom to me has been like a brother from another mother. Even when we graduate from the system, we still gonna be hanging out, you feel me? I'm gonna come pick him up because I'm getting my permit next year. Even when we grow old, I'm 50, he's 70, 60, still gonna be hanging out together.
So I've been a part of Big Brothers Big Sisters nationally and locally combined for most of my career, about 28, 29 years, something like that. And watching that, I think you can see why, right? The other thing we want to share with you before we get into our presentation is a quick excerpt from a news report of the Surgeon General's advisory that was released, as I said, in December 2021. If you haven't seen a copy of this advisory, we really recommend that you download it. We're going to provide it after the panels, I understand it. But I'll show you a quick news clip and then we'll dive in.
Across the country,
I definitely feel very stressed.
I've never felt so much stress in one school year.
I didn't want to get out of my bed today. I really didn't.
kids under pressure, pushed by the pandemic, Today, the Surgeon General issuing a rare public health advisory, warning of a youth mental health crisis.
Our kids have been struggling for a while, and we can no longer wait to address youth mental health in our country.
According to the report, symptoms of anxiety and depression have doubled during the pandemic. More than 140,000 children in the U.S. lost a parent or grandparent caregiver to COVID. And emergency room visits for suicide attempts were up 51% for adolescent girls compared to 2019.
How important is it that kids know they're not alone and that it's okay to talk about mental health?
Struggling with your mental health does not mean that something is wrong with you, and it's not your fault. We have to normalize that. We also have to let kids know that it's okay to ask for help.
So I think if you talk to any of us that are working with youth directly, we would have told you that we felt the crisis coming on long before COVID hit. You know, when you work with kids every day, we were talking about it at dinner last night, the violence that they see in their neighborhoods, their schools, their homes sometimes, the violence they see on television, watching, you know, the news reports of things like, you know, war across the ocean. They have an awful lot that they're carrying on their shoulders. So we certainly weren't surprised to see the Surgeon General's advisory. At the same time, we're thrilled that it was released because it does raise awareness for the entire country of that crisis. So just to get into some of the specifics, this information comes from Tramane's organization, Mental Health First Aid, and the National Council for Mental Wellbeing. Nearly 30 million people across the U.S. don't have access to comprehensive, high-quality, affordable mental health and substance use care when they need it. Children and youth are also very much affected. 1 in 5 youth lives with a mental health condition. 17.1 million youth under the age of 18 have had a psychiatric disorder or have one currently. 75% of mental illness develops before the age of 25 and 50% before the age of 14. And one other note on that the average time before a mental health challenge presents itself and shows signs or symptoms, the average time it takes for a youth to get help is 10 years. That gap is absolutely unacceptable and something that we can do something about, right? And the last note on this slide, the second leading cause of death for 15 to 24-year-olds is suicide. Some of the other, just to build on that, the information we've seen coming out of COVID, another really useful report is a report that just came out from the CDC that looked at the mental health of high school students, I believe. And a couple of things on that report. What that study found was that, and this is, I believe, a 2019, last part of 2019 study, 37% had experienced poor mental health during COVID. 44%, nearly half, experienced persistent feelings of sadness or hopelessness during the past 12 months. Things just weren't like that when I was in school. And I am also a person that watched 4 television stations as I was growing up, and that dates me at all. So I think, you know, what again, we've all experienced and seen on the ground with COVID is children were already struggling. COVID had an impact on everybody in the world, as you know, you heard earlier this morning. But we also know that impact was especially devastating for marginalized communities of color. So that's what we're going to focus on today. I do want to, though, just before I turn it over to the panel, bring a message of hope to this session as well, and to all of you. This study, or this finding, also came out of the CDC's work, and what they found was, in asking youth about their experience of persistent feelings of sadness, hopelessness, considered attempts of suicide, and attempted suicide, that if you look at the figures on the left, those numbers, the far fewer, lower numbers, percentages of youth affected, had someone at school that they felt close to, that they trusted. That really goes to the work that Big Brothers Big Sisters and my colleagues are doing around the country to try to make sure that trusted adults can learn about signs and symptoms early on of mental health challenges, have the language to talk about those challenges with children and youth, and get them access to the care that they need. Additionally, be supportive. Provide the right supports along with the right help. So I'm going to go ahead and introduce our panel. First, Dr. Virna Little, and I'll let you each talk a little bit about more your background and your organizations, but Virna is a co-founder and chief clinic officer with Concert Health. Tramaine EL-Amin, I talked about her slide a little bit earlier, is the client experience officer with the National Council for Mental Wellbeing and Mental Health First Aid. Brian O'Connor is probably my longest term friend up here. He is the cause marketing and public engagement campaign director with Futures Without Violence, an organization committed to ending violence. And Aeneas Williams is another friend of Big Brothers Big Sisters of America and the lead pastor at the Spirit Church, also an NFL Hall of Famer. And our last panelist is Dr. Dawuda Griffin. He is a chief psychiatric officer, and I can't see it, but I think I'm getting it right, at Centurion, a partner of Centeens. So I'm going to turn it over to Virna first, and what I would love for our panelists to do is just, again, quick introduction about your background, what you do, who you work with, and what your organization does. And then if you can also speak to what you've seen in this arena leading up to COVID and through COVID, and then also address what you see for opportunities. So Virna.
Great, thank you, pleasure to be here. I'm Virna, I'm with Concert Health and also the Association for Clinicians for the Underserved, clinicians.org, for some of you who may not have heard of us, longtime partner of the National Health Service Corps and working with underserved communities, and particularly clinicians serving those communities, and Concert Health bringing behavioral health to primary care. So I think to start off, to share, I received an email over the weekend from a staff person living in Alaska, and she shared an article with me, and the title of the article was "They Are Not Okay." And it was about children in Alaska who actually attempted suicide rates in the prior year exceeded the ones that you saw here. And really, to drive home, the take-home message is they are not okay. Our children and adolescents in this country are not okay. When I think about a time where we're talking about double-digit numbers in the communities that we serve for kids who attempted suicide, not thought about it, but actually tried to die by suicide, if that doesn't motivate everyone in this room, I don't know what will. And so thinking about what we're seeing children who are feeling disconnected. We're seeing them not sort of get the services that they need. And I think one of the take-home messages is that if we do what we've always done, we're going to get what we always got, which is poor prevention, poor access. And so I think really now the call to action is to think about what can we each leave here and do differently. So first I ask all of you, if you don't have the lifeline in your phone, put it there. I would also say to think about doing things like mental health first aid. As an employer, does everyone have mental health first aid in your organization? What are you doing about training around suicide or suicide safer care for your teams, both in healthcare or wherever you happen to be? We also have some opportunities to really think about prevention. So one of the things I know that if I were going to ask everyone here, when you were young, you got trained if you caught on physical fire, what to do. Stop, drop, and roll, right? Every one of us learned that. But none of us learned what to do if we catch on emotional fire. And so really thinking about how are we teaching our kids what to do, to think about some prevention, to start early and to start consistently so that everyone knows what to do and everyone knows what to say. One of the things I read recently that struck me, and we talked a little bit at dinner last night, was that many of the suicidal statements made by our youth go unanswered. And oftentimes because people don't know what to say, parents or caregivers don't know what to do, and that's a real opportunity missed. I also think about the engagement of primary care. So we know that many of the people that die by suicide saw their primary care provider. We know that oftentimes children and adolescents go to their pediatrician or their family doctor for annual or school physicals, and that is a real opportunity. When you go for an annual wellness visit, when you have Medicare, a required part of that visit is screening for depression. There are no requirements for adolescent well visits. So what are we doing to really, one, train primary care providers and pediatric providers? And thank you, Centene, for your support, helping to do that nationally, but also to think about what opportunities we have to actually have conversations, to do routine and regular screening, and then train primary care providers and their teams to know what to do to make sure people get the help that they need. And so hopefully today, along with my panel, we'll give you some very concrete suggestions and thoughts about what we might do moving forward. So thank you for your time.
Great. Thank you, Virna. Tramaine.
Well, hello there. I'm just excited to see real human beings in a room together. And I'm so excited to be with you. My name is Tramaine EL-Amin, and I get the opportunity to serve as a client experience officer at Mental Health First Aid for the National Council for Mental Wellbeing. That's what I do. But what I will say is it's being in community is what I love. And that's one of my favorite words, community. And I think that is what, if we think about just the arc of where we are today, that's what kept us, that's what helped us get to be in this room is community. And so I think one of the things that if I have 4 minutes before someone takes me off the stage, I want to share and leave with you is that I've spent nearly 20 years working at the intersection of mental health, public education, and equity, and really helping to shape what it means to go into communities and be with community, to build community around education for mental health prevention and early intervention. One of the things that I saw in Philadelphia as I worked there at the Department of Behavioral Health and Intellectual Disability Services is this opportunity to transform how we engage communities with a public health approach, a public behavioral health approach. And at that time, the whole systems transformation was happening around how we paid for and supported mental health services and substance use services across our city. One of the things that I get excited about is this opportunity to change what language we use. Anybody ever call you the wrong name? Yeah, how did you respond to that? What did you feel in your bones? Now you know with a name like Tramaine, I get called all kinds of things, right? But if you were named and someone calls your name and you recognize that, it does something else for you. It helps you to recognize who you are. It embodies who you are. And when you're empowered with that language, you have the ability to really change how you interact and engage with others. And so that's what we want to see. We want to see people feel comfortable in having some uncomfortable conversations sometimes around mental health. I think one of the things that I'd also share with you is that all of you in this room, many of you are providers of some sort, right? You might be like my partner, the friendly neighborhood child and adolescent psychiatrist, or you might be someone who is providing support in an office setting. Either way, you're doing something to help someone understand or at least ask about how they're doing. And that's fundamentally what mental health first aid is. It is, I heard it said once by a pastor, helping us be better humans and better neighbors again by actually having the language to ask someone, how are you doing? It's a gatekeeper training, but it's more than that. Often we raise awareness when it comes to mental health and mental well-being, but we don't necessarily have actual action that goes alongside that awareness. And so it's really important because professional help is not always going to be available. I don't care if we multiplied everyone in this room times 10, we still don't have enough folks to be there when those young people that we care about in our neighborhoods, in our homes, in our communities, have that first thought of suicidal ideation and they don't tell us about it. Maybe they're holding on to it because they heard someone else in their space say things like, oh, it's not about all that, just pray about it. Or maybe we add prayer and add support and add treatment to support a young person in their process. One of the things I also want to mention about community is that communities have been doing this for time immemorial. There's been this opportunity to take what we've already learned in community about evidence-based practices and make them practice-based evidence. It's the things that are in communities, the mutual aid, all kinds of ways that communities support each other. If we apply that to a evidence-based practice and allow the two to really engage together within communities, what you can have is a training that allows someone to recognize warning signs, but is done through the lens of the people in community. And those individuals bringing their knowledge, their support, and engagement based on what they see as practice-based evidence. 30 million people across the United States do not have access to the treatment and supports around high quality mental health care. And that's a problem, but it's even more of a problem for our young people. It has a real direct impact on our school age youth, and our crisis is worsening. We were already in a crisis prior to the pandemic, as you can imagine. And so it's really important for us to understand that the need is great, but there's something we can do. And what we can do is get trained. We can give the supports to the community to do what they're already doing, paying attention, but give them the language to know and to recognize when a young person might be experiencing a mental health challenge, when that statement of "I'm tired" or "I can't do this anymore" is not just a statement about their day, but a statement about their spirit, about where they are, and that need for them to connect with a trusted adult to get that support. One of the ways we do that through mental health first aid is we've trained 2.7 million people to recognize those warning signs, and more than 500,000 within schools themselves, the K-12 schools. Those adults are trusted. They're already in community with young people, and it's important for them to recognize. But what we also recognize is that young people themselves are actually helping each other. So do we want them to do that without the right skills, without the right tools? We've created, in partnership with Born This Way Foundation, brought teen mental health first aid over from Australia in the last year and launched it, and more than 125,000 young people have recognized those warning signs. What we've also seen is that those young people are using these skills to the tune of 60% of them, 66% of them after the training, just 3 months after the training, have used those skills to support a young person and one of their peers. I think that's important because young people are not going to come and tell us exactly what's going on with them. They are going to talk to each other before they come and find that trusted adult. So we want to give them the skills to be in community with each other, but to also be in community with those trusted adults in their spaces already. I would love to go into all of the impacts that we've seen happen and the amazing stories that we've heard. But one of the things that I want to close with as we're thinking about what this looks like is the fact that, Einstein said, not everything that can be counted counts, and not everything that counts can be counted. And so one of the things that's important is this notion of making sure that we take what works already in community, add that to some evidence-based practices, and then put that to work so that we can make an impact. It's going to take all of us together for that to happen. The other thought that I want to leave with you is that though the crisis is real, so is hope. And so it's really important that we do all the things we can to equip people with tools because our youth are requiring it of us. If you haven't noticed, they're not waiting. They are changing and transforming how and what they demand from us as it relates to our healthcare system. And I'm confident that with the right tools and the right community, we can respond. Thank you so much.
Thank you, Tramaine. Brian.
Great, thanks so much. Hi, everybody. Yeah, right? Hi, and just as a segue from what Tramaine, my partner here, my partner in peace, is talking about when you think about, what can be counted, what we're talking about when it comes to to statistics oftentimes too, is after something's already occurred, right? The crisis is already there and it already exists as we're talking about it. And how do we measure prevention? How do we measure something that didn't necessarily happen? And so I'll get a little bit into that a little later with some of my remarks, but isn't that where we really want to be, right? I really want this to be, and we talked last night too in preparation for this conversation, is to be that, right? So there's going to be some time at the end as well for questions and for comments. Every time I'm in spaces like this, and I've been doing this work for quite a bit as well, I'm always learning, right? And so taking the wisdom of this room is going to be also really, really important. We're talking about this in the capacity that as your mind might be thinking about some of the things my colleagues have already shared, is thinking about like, how is this impacting me in my personal life? Certainly, right? When we look at the data too, and we think about what are we experiencing when it comes to the issue around the pandemic, but also all of the struggles, challenges, opportunities, joys that we had before it too, right? And now we're talking about how do we then support other people? I oftentimes say that self-care kind of irritates me a little bit, to be honest with you. The title, the word self-care, as we've heard a lot, it's in the headlines of what are we doing for ourselves? Like we're only just one bubble bath away, right, from being all okay, right? But it is the analogy of when you're on the plane to put your mask on first and then be able to help others. And so we're thinking about this in a personal capacity, I'm sure, and also professionally what we can do in the context of how can we also help each other? It's self-care and it's community care, right? So when thinking about that, certainly we have to identify what we really need to heal and to be healthy. And also though, how are we also taking care of each other to also heal and to be healthy? And so in the context of young people and what we're specifically talking about here today, I want to just of course thank the National Minority Equality Forum, Centurion, and the organizers too that brought us here. I'm based here in San Francisco and I made it here even with a recent injury, and so I want to thank you all for bringing us together, and also particularly our Big Brothers and Big Sisters of America and the National Council for Mental Wellbeing Partners. I work at Futures Without Violence, and we're also the Big Brothers Big Sisters of America and National Council. We're about to initiate a national effort that is going to really focus in on reaching particularly boys and men around positive mental health supports. And we're going to also lean into and have an emphasis on boys and men of color within that context. And I'll get to why we're also focusing in there, because that's really where my work with Futures Without Violence really started. I have been with Futures for 15 years. Before that, I was in communications, I was in advertising, and I was a journalist, and really pulling out the human interest stories, right, that change hearts and minds and really inspire us to actually get involved and to do this work is really important. And so that's about raising awareness and visibility for these issues as we're doing today, and we continue to do in our work. And at the same time, in order to be responsible, we really want to make sure that there are supports and services that follow up that awareness. So the awareness, right, and where I lean into, and the work that I've been doing around how we really look to incite public engagement is one thing. And when you have people leaning in and saying, okay, what is it I can do? Where can I get trained? What should I really know? What are the things I need to say? Right? That's really when we get into the specifics. So people might be leaning in, but do we then have the infrastructure, the systems, right, the support, whether they be formalized systems or even informal? When we think about what is in community, we think about neighbors, we think about folks at our church, et cetera. Do we have that system of support really to be able to then kind of heed the call, right? You can raise awareness all you want, but also we really need to be responsible that we have the tools and the resources there that are also really available. And so I know Dr. Puckering, I believe at the beginning, was talking about communications and the role, talking about Twitter and whatnot. I mean, it's so important to identify and spotlight that this is an issue, and then what is it that we're actually then really being able to do. So particularly with my work, though, really what I want to call out is, and I meant really to lean into the informal structures and systems that we're talking about, because not everything involves a professionalized service, right? First of all, sometimes, as also my colleagues have said, that professionalized service might be too expensive, it's cost prohibitive, there's a shortage of professional clinicians as well that we know are there to administer solid treatment, particularly when one needs, say, behavioral cognitive therapy. I mean, we know that intensive interventions are really important, but in thinking about that 10-year gap that Julie talked about, right, where mental health issues, challenges are first presenting, right? It does take a constellation of caring and consistent adults to identify and recognize and understand, and then be able to either refer to more intensive treatment and also just to be able to provide support. This is an and, it's not an or, right? So if it's cost prohibitive, there's a shortage of professionalized services and clinicians that might be able to show up. It might be inaccessible depending on where you live in, say, particularly rural areas, or frankly, that person doesn't look like me, right? That person, I don't really know that person. They might not necessarily understand my experience, right? They might live in my town, but they live across the way, right? And across the way can be really different from understanding what I'm going through and what I need, right? And so the work that I do, and when I was talking about with a focus with the new work that we're going to launch soon, drum roll please, right? Is around the men and boys work. So I came onto Futures Without Violence. Our core mission is particularly around working to end gender-based violence. Domestic violence, stalking, sexual assault. And so I came on to build out a portfolio that really looks to intentionally engage men and boys particularly. I actually thought it was going to be really a men's campaign where men are going to be talking to other men about relationships. And what we realized certainly is that a way in and a less intimidating proposition is to bring men into the fold around this work through young people and leaning into the role model, right? And so in thinking about that, we launched a program called Coaching Boys into Men. And Coaching Boys into Men works with athletic coaches. And at first it's a metaphor that coaching, anyone can be a coach. So when we talk about the core protective factors that helps keep our kids safe and helps them thrive, really around a caring, consistent adult. I mean, the CDC, there's evidence behind this, folks, right? It's not just really kind of Pollyanna and pie in the sky and sounds really nice. There is solid evidence around, when we think about the essentials for childhood, around how we can help build tools and guidance to everyday adults on building safe, stable, nurturing relationships for young people. What we did at Futures, particularly around our work engaging men and boys, was leaning into leveraging sports as a platform in order to do this. So in recognizing that coaches, and that anybody can be a coach, but that coaches particularly have a daily opportunity. Sometimes these athletes, right, these young student athletes are spending more time on their team, right, than they are at home with their parents or maybe even with their friends. And so there's a solidarity. Aeneas and I talked about this last night, and it's going to be kind of a segue into what he's going to share and talk about. I mean, hello, NFL Hall of Famer right next to me here. But so I'm talking about leveraging sports, but there is an influence and a platform there. So whether or not you're all coaches, there might be coaches in the room, and I talked about the personal and professional kind of dichotomy, right, of what we're doing then within our own personal community, family lives, and then in our own professional context. It's how we're braiding that too. I talk to everyone, not only that everybody can be a coach, but whether or not you have young people in your life who play on a team, how you introduce some of this work, right? And some of this evidence-based work, that's practice-based evidence around what that really looks like. People might be leaning in, and when we're raising visibility, that we need more than just the professionalized service that I was talking about, but that it's an and, not an or. When you're leaning into that, right, how are we then talking to our school administrators or our pastors or our neighbors? Or when you look around your network and people who you're connected to. There's many opportunities for us to have a conversation. And so that's one thing that I'll just end with when we think about this, around thinking about at lunch or later on tonight, or if you're gonna call your cousin, or when you're on, with checking in, right, with home, and being like, what did you talk about today, right? Because, and that's the informal way in which we're kind of raising, we're sounding the alarm, but we're also really building out a really big cadre and solid stable of all of us that care about this. I'll just say one quick thing about the Coaching Boys into Men program, and it's a quick story of this young man who was a junior in high school, football player. And when we first started this work over 10 years ago, he said, we're following up after the program. It's a weekly program where the coach facilitates a conversation around personal responsibility or digital disrespect and understanding consent, and going to a whole host of different issues that help peak performance on the field, but also really important that we talk about more than X's and O's off the field as well. He said, at first it was a little awkward talking to coach about this kind of stuff, but it really became more comfortable and so important. We're just expected to know. Nobody talks to us about this stuff. And so when you think about us, just because we're not talking about it doesn't mean it's not happening, and we have to be intentional, right? That the best defense is an even better offense. So thanks a lot for your time today.
Yeah. Thank you, Brian.
Good morning. My name's Aeneas Williams, and I grew up in New Orleans. I'm so glad to be here with this panelist and the groundwork that you guys are doing. I come from a football background, so I want to get everyone involved. I know you all have eaten breakfast. So I want everybody to say, we can do this.
We can do this.
Now, everybody didn't do it. All right, I used to hit people for a living. All right, come on. Come on, we can do this.
We can do this.
Because sometimes when we're dealing with challenges and the things that were happening, we have mental challenges, mental health issues in my generation. We just manage it differently, but a lot of us still need help. And being on this panel, I want to thank Joyce Larkin and Centene, the Spirit Church family, because hopefully I'll get through this without crying.
All right.
But I want to start off with a practical tip, because you talked about pandemic, because you have to do something, man. Otherwise, I don't care what level of life you live, whether it's from the communities of inequities or wherever you are in Beverly Hills. There are challenges. This pandemic had no biases. It impacted all of us. So there are a couple of things that I'm learning, and one of the things is to see positive things in every situation. So one of the things, Brian was walking up and he had his crutches, and I didn't say it, and I want you all to say things good when you think them to people. So Brian had his crutches, he's walking up, I see his boot, and I should have told you, your left leg is going to be twice as strong, right? See something positive, right? There was another person in prison, and the guy was on his way to the electric chair, and he walked by one of the prisoners as he was going, and the prisoner was a positive guy behind bars, and as the guy being executed, headed to execution, walked by him, he says, "More power to you." You're supposed to laugh at me. Yeah. It's a tough group here, all right? Maybe I'll try one more, all right? So there are two military. There are two guys in prison. They have a conversation. He said, "What are you in for?" I went AWOL. I'm in for 40 days. And so the guy, he asked the other guy, he says, "How many days you in?" He said, "I'm in for 3. He said, "What did you do?" He said, "I killed the general." And so the story has a lot to do with finding positive statements in every situation. There's a picture here of a young lady who's my daughter. Tirza and my wife Tracy and I, we have 4 children. And when it comes down to mental health, when it comes down to all the things that we're now facing, regardless of community, I know we're focusing right now on inequities because I'm in so many different environments. All of us need to be aware of this. So Tirza is now a graduate. She graduated magna cum laude in communications. And Tirza attempted suicide. So now my wife and I, Tracy and I, have been married 29 years, and now we're growing up. And sometimes I want to share with you things that you may be dealing with in your home. It may not just be for you. So a lot of times God may allow a situation that we're dealing with to actually educate us and make us more empathetic for other people who are going to need our help later. So a lot of times when you're thinking about why me, start thinking about, okay, why will I be now used later to possibly help someone else through a trauma? Her name is Tirza. We named her from the tears in the Bible. Her name means gentle and pleasant. And she's the daughter of a group of daughters that approached Moses to get their property because they didn't have any male brothers, And back then, the brothers, when the dad died, the brothers got the property. So Tirza led her sisters to Moses, protested to Moses. Moses went to God, and God told Moses, Tirza is right. So this young lady, trust me, you will hear her voice in different places. But she taught me a lot of didactic lessons. And one was to be a listener. Because one of the most powerful things you can do is to listen. When you grow up in an environment in New Orleans, you see 10 of your friends murdered, and you see these things, and people tell you, suck it up, or be a man. And you have this wonderful, beautiful game of football. I always jokingly, when I open up, I was following my brother Achilles, not knowing, because we're talking about policies, we're talking about prevention. One of the preventions can start at home. And one of the initial catalysts for mental health challenges, possibly, I could be wrong, is purposelessness. When you're living a being and in a society, you really don't know how you fit in, so you start inwardly being challenged. So with me, my two older brothers, they were studious guys. They were guys, if my parents dressed them a certain way, when they left the house, they came back the same way. I was totally different. How they dressed me, they couldn't tell when I came back how they dressed me. And it was nothing wrong with me. I was kicked out of Incarnate Word at 3rd grade. Not because something was wrong with me. I was just different. I'm not the type of child to sit at a desk for 5 hours. But if you put me outside and help me learn, I'll ace it. So part of it is learning to know, to grow. The world has changed. The world is changing, and so do we. We have to think differently about situations. So the crazy thing, when you grow up in this kind of environment, I grew up with great parents, middle class portion of Holly Grove, same area where Lil Wayne from, but the environments that I was in. And I'll never forget, I joke with a lot of young people we'll be speaking to later. And I said, man, I was following my brother who's a CPA. He's a numbers guy. He's been a numbers guy since elementary school. I literally had cloned my life after him. All I wanted to be is little Achilles. And Tramaine is talking about people mispronouncing their name. How would you like when people mistakenly call you Aeneas all the time, all right? So you hush, lady, all right? But literally, I have a degree in accounting and I don't like numbers. Following Achilles. So I learned, my parents modeled hard work. I learned you could work hard, get up the wrong ladder. So part of my challenges were, once I walked on Southern's football team, my junior year in college, a week after the season started, because when I gave my life to Christ, I say, Lord, if you're real, tell me how you relate to us as humans. He says, one thing, Aeneas, I make humans and everything with a purpose. So every one of us have a purpose. And the second thing, he speaks to all of us. And a lot of times he's speaking in indiscriminate, non-wild ways. So this final part with tears, a didactic lesson. After she went through what she went through, she came back and she's never been the same in a good way. In the hospital, she just remembered looking at everyone else, and she made a statement. She says, Dad, it's not as bad as I thought it was. And sometimes when you're sharing and talking with younger people or grown adults now, sometimes it's helping them get to one more day and helping them, even by listening, to come to their own conclusion that it may not be as bad as you think. Tirza is thriving, one of the happiest young people I've ever been around in my life. But this journey she's gone through has now given her the empathy, and her parents and our family, to listen closely. So when I'm on the call with Commissioner Roger Goodell, the owners, and the work that I do at the National Football League, which works with Big Brothers, Big Sisters, the work that I was able to do, we were able to do in Ferguson. One of the main things when we were walking, my church was in Ferguson, Christ always walked down the center of the street if there were opposing parties to attempt to bring them together. And when we were walking on the Ferguson streets, the great thing I had an opportunity to do was to talk and listen to young people, to hear their perspective so we can provide better solutions. So shout out to Tirza and every future Tirza in this room that ever think about ending your life. Give us one more day, and I promise you something beautiful will come from that. So the final portion is being on the call with the commissioner. I'm on the committee with the National Football League Inspired Change, where there's $360 million earmarked over 10 years toward organizations like Big Brothers, Big Sisters to cause change in these spaces of inequities, Dr. Gary. And when I was on the call, there are 4 pillars that were targeted, but I introduced mental health for consideration to the league and the players to begin to use our voices to let young people know one more day, and how each of them at different times in their lives, players, have thought about ending their lives. And we want them to tell their stories unashamedly. Thank you.
Wow. Thank you so much for sharing that story. Thank you. Dr. Griffin, and two-time Big Brother, by the way.
Good morning.
Good morning.
How do I follow that? It is a pleasure to be here with you this morning, and it is an honor to be a member of this esteemed panel of experts. Of course, I'm sitting up here on the dais with them, but can you feel the passion? Is that coming through? Yeah. So my name is Dawuda Griffin. I am a physician, specifically a psychiatrist, and I specialize in adult as well as child and adolescent psychiatry. I am employed by a company called Centurion, who provides healthcare to incarcerated individuals while they are incarcerated. So for you and I, healthcare is a privilege. But the moment an individual becomes incarcerated, healthcare becomes a right, a constitutional right, in fact. based on the 8th and 14th Amendments of the Constitution. So before I go further, I would like to thank Joyce Larkin with Centene, who is the parent company of Centurion, and Julie Novak with Big Brothers Big Sisters, as well as the National Minority Quality Forum for bringing us all together. One of the themes that you have heard in each of these amazing presentations that you've experienced this morning is prevention. And as it relates to the mental health or mental illness of our youth, prevention is a really important factor. And so I'd like to share with you how I, through my experience, view prevention. There are 3 A's. The first A is awareness. Okay, awareness. You've heard this previously this morning. So it is unique with mental health as a medical specialty in that you cannot do a blood test or an X-ray to tell how depressed someone is or how anxious someone is. So mental health and mental illness is largely based on language. And before you can get that language out, the first thing you need to do is to be aware. So it is incumbent upon the individual who is struggling with their thoughts, their feelings, or their behaviors to be aware that something isn't quite right. That's the first step. It is also important for that individual's support system, kinship system, guardian, parent, to also be aware. Be aware of how the child that you are responsible for is doing mental health-wise. So changing the perception of it's my role to keep my child healthy or off the streets or out of trouble to adding and has good mental well-being is really important. The next level of awareness would be community. So faith-based organizations, community centers, schools, the community as a whole needs to be open enough to be aware. And so discussions like we are having this morning are part of that awareness. So that's the first A. The second A is access as it relates to prevention. So we've heard about this morning. We heard about it with our Hometown Hero Award recipient, Nurse Carla, and how she, as a healthcare provider, went door to door in her neighborhood to vaccinate folks. So typically, the medical model is that those in need of healthcare go somewhere to receive that healthcare. And what is sort of changing and what we are learning works best is that we need to turn that 180 degrees and we need to bring healthcare to the people that need it. So as it relates to the mental health for children and adolescents, what do? They go to school. So the idea of school-based clinics, they participate in sports. So equipping the coaches and the sports organizations with access to mental health care, along with awareness. They are part of faith-based organizations, so allowing access through those vehicles as well. So access, okay? And then we move into accountability. And so as an individual who becomes aware that they have something not quite right with their thoughts, their feelings, or their behaviors, it is incumbent upon them to use that language and say something, okay? They have to be accountable to push that language out, that something isn't right, I need some help. And then the parents and the community members and the teachers have to listen to then make sure they have access. Also, as we think about those parents or guardians, communities, they also need to be held accountable to not only be aware, but to make sure that they have systems in place to not necessarily provide care themselves as if they were a provider, but at least have an understanding that mental health and mental illness is real and that things can be done about it, okay? And then on a sort of community or government level, we need to have legislation and policies in place. We need to hold ourselves and our legislators accountable to have that, to help support and provide that access. So those are my 3 pillars of prevention, okay? Awareness, access, and accountability. Prevention is not something that is reactive, it is proactive. Moving on to the work that I do in my business every day, I want to briefly mention how incarceration can affect the mental health of youth. So of course, when a person becomes incarcerated, you are removing them from that family system. They are no longer able to provide financially. They are no longer able to provide emotionally, educationally, and in all of the ways that we have come to expect to that youth. In addition, what I have seen time and time again in the incarcerated youth that I work with, and even the adults, is that there is a reunification fantasy that can sometimes occur. Meaning, just like a child whose father is a police officer or is a butcher, or a child who has a brother who becomes an accountant, and you want to mimic that individual. If you have a grandfather and a father and an uncle who have been incarcerated, that becomes your goal, whether intentionally or unintentionally. And what I have learned since working in corrections is that sometimes being justice involved is the family business. And that's unfortunate. So how has the pandemic affected youth mental health from my perspective? Well, I want to share with you 2 things. The first is, in the children and adolescents that I have treated throughout the pandemic, I have seen an increase in suicidal ideation. So usually it is related to back when in-school learning was suspended. It was related to isolation, and it was related to decreased academic performance, not really adjusting well to the social change as well as the academic change in terms of how children were learning. It became much more difficult. I happened to have my 3 nephews with me when they began school during the pandemic, and I found myself sitting at the dining room table trying to teach my oldest nephew Mandarin. I'm like, how are parents supposed to do this? It was insane. And I've also seen a burnout with parents. So parents have become teachers. They have moved to, when school was in-person learning was suspended, they had to not only provide 1 meal in the home per day, but now 3. They had to figure out who's going to watch the children during the day, who's going to keep them safe, who's going to keep them on track. These are monumental tasks that have led to burnout. And for the sake of time, I want to end with a personal story that's quite recent. It's sort of sad, but also hopeful, and ties into an example that we just heard. So since Thursday evening, I have been on call for a community mental health center that has an inpatient psychiatric unit for adults as well as children and adolescents. And on Saturday morning, I admitted to the unit a 12-year-old girl who was suicidal. She had no previous mental health issues whatsoever. But due to being consistently bullied at school since returning to in-person by another girl who used to be her friend, she became despondent. She had let the school officials know that this was going on, and it was bullying in the form of physical aggression. And the school officials sort of stepped in a way that ended the bullying on the school property, but this peer of hers also rode the bus with her. And the physical aggression was continuing on the bus. And so with her 12-year-old developed brain, her only way to solve this, after sharing with the adults in her lives that this was going on and it wasn't solved to her satisfaction, was to consider ending her life. But whenever I have an instance such as that in front of me, I love to ask the individual about future-oriented goals. So I asked her what she wanted to be. And she wanted to become a softball player, a hair braider, or a nail tech. And what that does is it allows me to say, well, how can you achieve those things if you're not here? You are a valuable human being who was put here for a reason. And what I want you to know, and what I need you to understand, is that the pain and suffering you are feeling now, it will not last forever. We can solve this. It has not been solved to your satisfaction to date, but life can be better. And her response was, I believe you. And I'm glad that my mother and my grandmother brought me here, because it wasn't until I got here that other people told me the same thing that you told me. I never realized that life could be better, and that this peer who used to be my friend, who was bullying me and beating me up, will someday be poor or in jail because she bullies good people who are kind and calm. And so what my colleague Aeneas has shared with you, share people that there's one more day. Listen. Let people know that there is another way. Can be so valuable and so impactful, and I've seen it time and time again in my career. And I hope that you all, faced with that situation, have an opportunity to do the same. Thank you for your time and attention today.
All right. Thank you so much. And unfortunately, we don't have time for questions, so we want to point you again to the resources you heard talked about today that will be available to you. Tramaine also included resources on mental health first aid and teen mental health first aid in that information. So thank you again to the forum for having us. Thank you to everyone that helped bring us here. Thank you to my colleagues for joining me on this stage. I was honored to be here. I am honored to be continuing to work with you. So, all right. Have a great day, everyone.
Great job.